Hello, my name is Gregory Jono. I'm a senior SRNA at FIU, and I'd like to thank you for viewing my educational module on the utilization of magnesium sulfate as an adjunct to peripheral nerve blocks to reduce postoperative opioid consumption. Some learning goals as we get started is to understand the consequences of inadequately managed postoperative pain, understand the potential adverse effects of opioid administration, realize the benefit of magnesium sulfate when used as an adjunct to peripheral nerve blocks compared to local anesthetics when administered alone, and appreciate the lack of side effects seen with this magnesium sulfate administration. Some background into the problem. Currently, the United States performs approximately 50 million surgeries annually. Unfortunately, a third of these patients have moderate to severe pain during the first 48 hours. A big risk exists in the development of chronic pain if this postoperative pain is not managed adequately. And although there has been a recent emphasis on enhanced recovery pathways, opioids remain the mainstay of primary analgesic methods, regardless of their proven side effects. Now, these side effects seen in opioid administration include respiratory depression, nausea and vomiting, bowel dysfunction, urine retention, shivering, and difficulty concentrating. Together, these opioid side effects lead to increased treatment costs, increased length of stay, delays in resuming daily activities, and an overall decreased quality of recovery from the patient perspective. Additionally, increased opioid consumption has been correlated to increased risk of requiring total joint revision in hip and knee surgery patients. There are some additional concerns regarding opioids aside from the immediate postoperative issues that include the fact that 125 million opioid prescriptions were dispensed in the US during 2023. This shows that opioids continue to be the primary analgesic utilized by providers. Studies have given evidence that only 28% of opioids prescribed at postoperative discharge are taken by the actual patient. This grants the opportunity for medication diversion and substance abuse, which can boost the opioid crisis we have been facing in this country for this past several decades. Additionally, long-term opioid consumption needed to treat chronic pain syndrome stops the endogenous opioid production. This results in a physical dependence on exogenous opioid administration. The Center for Disease Control and Prevention report that 108,000 Americans died of a drug overdose in 2022, and 76% of these deaths involved an opioid. Peripheral nerve blocks provide a maximum duration of analgesia between 8 and 16 hours. Several adjunct medications do exist that have the ability to prolong analgesia. Now, during peripheral nerve block administration, local anesthetics are injected around neural structures that have blood vessels in close proximity. This creates a circumstance in which absorption of these medications is possible, resulting in systemic effects. Some of these medications used as adjuncts have the potential to have unfavorable side effects in specific populations. Magnesium sulfate has been studied extensively and has been proven to prolong analgesia without causing systemic effects when absorbed systemically. Some of these adjunct medications and their associated side effects will be discussed during this presentation. Let's quickly take a look into the mechanism of action of magnesium sulfate and how it benefits us during perineural administration in peripheral nerve blocks. To begin, magnesium sulfate is the fourth most abundant cation in the human body. Magnesium was first used to treat arrhythmias and preeclampsia, then its effects on anesthesia were realized. Magnesium sulfate is an NMDA receptor antagonist in which it regulates the intracellular calcium concentrations to prevent transmission of nerve impulses. When administered into peripheral nerve blocks, the CSF concentration of magnesium sulfate remains unchanged. This suggests that its mechanism of action takes place through peripheral NMDA receptors and not in central receptors. We will now look into some of the evidence that was found in literature. There have been numerous studies investigating magnesium sulfate with peripheral nerve blocks. Two such studies investigated the co-administration with lidocaine in peripheral nerve blocks and found that it prolonged analgesia, one with femoral nerve blocks and another study with infraclavicular nerve blocks. Additionally, it was found to prolong sensory motor block when used with ropivacaine in axillary nerve blocks. And another study found that it had comparable increase in adjunct analgesia to ketamine as an adjunct, but it lacked the side effects seen with ketamine as it was absorbed systemically. These side effects included hallucination, nausea, and nystagmus. Continuing with the studies, magnesium reduced heart rate and blood pressure more than when the local anesthetic was given alone, but Precedex did show more of a reduction than both magnesium with the local anesthetic and the local anesthetic alone. It extended analgesia less than Precedex, but it lacked some of the side effects that the Precedex participants experienced. Side effects seen with Precedex as an adjunct included hypotension, bradycardia, and somnolence. A study into the dental nerve blocks investigated the success rates and found that when magnesium was used as an adjunct, the success rates jumped from only being 53% to 82%. Each of these studies had a reduction in opioid consumption in the magnesium sulfate groups. Some take-home points to remember regarding this educational module is that magnesium sulfate, when used as an adjunct to peripheral nerve blocks, offers the ability to prolong analgesia. This can be accomplished without causing the unwanted side effects that we see from some of the other adjuncts when the medication is absorbed systemically. And it prolongs the analgesia offered by peripheral nerve blocks, which can lead to an extended time to first rescue analgesic request in the PACU, reduce postoperative opioid consumption, and enhance recovery. Here are several references that were used during this investigation. I'd like to take a second to thank you for viewing this educational module on magnesium sulfate as an adjunct to peripheral nerve blocks and its reduction in opioid consumption in the postoperative period. Thank you very much.